So I originally never considered doing a video about my recovery from knee surgery, but after I had multiple physical therapists say, it's unbelievable what happened to you, and you need to give us your protocol, or you need to tell people what you were doing. So that's why I'm making this video. So if you or a friend of yours is having knee surgery, specifically for me, knee replacement, or any kind of major joint surgery, I'm going to give you exactly what I did to have what most therapists consider to be just a miraculous, speedy recovery. And I want to show you something really quick first, and that is that that I can easily do this. Now you might think, well, that's not a big deal, and maybe it's not for most people, but my surgery was a little over 4 months ago, and prior to that I couldn't remotely do that, and hadn't been able to do that for a few years. And I was actually able to do that 2 months ago. So let me just give you a little bit of what you do before and then right after, to help you recover as fast as possible. And this will maybe double the speed in which you recover. So first, before surgery, get in as good a shape as possible before surgery. Don't, you'll be tempted to think to yourself, what's the point in getting in shape, because I'm going to be laid up and then I'm going to have to work hard anyway, but you're going to make it hard on yourself if you do that. If you come into surgery in pretty good shape already, it's just going to make your ability to hit the ground running, so to speak, a lot easier. So specifically, work your legs and whatever joint you have in the exercise or the procedure on, and do some cardiovascular stuff and strength training, but get yourself in decent shape coming into the surgery. Now, specifically a week before surgery, what I did is I went completely anti-inflammatory from a diet perspective, starting 1 week before surgery. That means all I ate was lean proteins, nuts, and fruits and vegetables. Nothing that could provide inflammation for my body. So no sugar, no white flour, and nothing that resembled, no simple carbohydrates, except the ones that I would get from fruit, which is the most natural source. So complete anti-inflammatory diet, no alcohol, starting a week before. High amounts of supplements, really, all types of supplements across the spectrum to make sure my body was fully fortified and completely nourished. The only thing I stopped within 1 week before surgery was vitamin E and fish oil, because of the blood thinning effects of those particular nutrients. Okay, so that brings you into surgery, and then immediately after surgery, in the hospital, I began taking massive amounts of a specific enzyme product that is unbelievable for reducing inflammation. I'd already helped tons of people over the years recover faster from surgery with this group of enzymes alone. And I was taking tons of it. Literally, I smuggled them into my hospital room and started taking them as soon as I woke up from surgery. Tons of those, tons of a specific antioxidant called OPC, MSM, and a strong cherry extract. Those were not only for inflammation, but also for healing and for pain reduction. So obviously you're going to get out of the hospital relatively fast. I was home within a couple days. I maintained the anti-inflammatory diet for the first month to 6 weeks afterwards. So same protocol in the way I ate, and no alcohol. I had my first glass of wine like 5 weeks after surgery. Maintained the same supplement regimen, heavy on the enzymes, and started physical therapy immediately. Started physical therapy the next day. And so here's what you need to know about physical therapy. Do exactly what your therapist tells you, and don't do exercises they don't tell you to do. They know best what your body can handle, what your muscles can handle, what your joints can handle, because you've got this delicate balance between healing and strengthening and regaining range of motion. But it's a delicate balance, because if you go too aggressive, you will damage the wound, which is an excessive wound. You're talking about opening up the leg, literally cutting cutting across the femur, cutting across the shin bones and taking the knee out and putting a new one in. And so same thing for any kind of joint replacement. It's a really serious thing. And so it's a tremendous amount of healing. I'm still healing 4 months later, even though no one would recognize that that's the case because of what I'm able to do. And so follow what the physical therapy says. So you're going to go to physical therapy probably 3 times a week. So do everything you do there, but also every day do at least 1 other session. So I was doing 2 sessions of physical therapy per day. So the days that I was in therapy, I would do my therapist session plus another one at home. And the days I didn't have physical therapy, I did 2 sessions at home. And then ice 4 times a day and specifically after, but also heavy amounts of the enzymes and anti-inflammatory diet. The second week after my surgery, my therapist said to me, Todd, I hope you're documenting this, because the difference in the inflammation, and my therapist is one of the best in the area, has been doing physical therapy for well over 20 years, has worked with tons and tons and tons of joint replacement patients. And she said, I've never seen anything remotely like the speed in which you're healing and how fast the inflammation is going down in your leg. And she knows the type of protocols that I was on. She's like, it's just unbelievable. I hope you're documenting this thing. By the 5th week, I was able to walk down steps like you do. If you walk down steps normally, that's what's called reciprocal. 1 step after another, straight down. The average knee replacement takes 10 to 12 weeks before someone can walk down the steps, 1 step over another. Within 2 months, I was paddleboarding in the Caribbean. I was able to do that without any problem at all, which meant also regaining balance, which is a really challenging thing to get back because everything's been cut. There's no nerve connection to the bone in your knee, so you don't have full nerve going right through this. And I'm no Superman. I'm a normal guy. Yeah, I do take care of myself. I'm just giving you a protocol that will make your life so much easier. You will recover so much faster. You will have a way better experience during recovery, and you will be back doing the things you no longer could do or have always wanted to do for a long time freely. I mean, I'm able to do things now that I could not do. Prior to my surgery, I couldn't go for a 10-minute walk on the beach with my wife. I wasn't capable of that. If I was standing up and talking to a group of people, which I do from time to time, I couldn't stand more than 10 minutes without being in intense pain. So it was really bad. I had already waited 3 years too long to have the replacement. So the recovery has opened up. I'm already where you would be. It takes about 8 months to get where I am right now. And I'm there because of the protocol that I just gave you. So if you have questions and you want to know more about certain things, you can feel free to email me. And as I have time, I'm happy to help anybody because it's a hard surgery. Any joint replacement surgery is really hard. Don't kid yourself about that. It's going to be hard. But it's worth it. If you do the right things, you will recover way, way faster than most people who don't do the right stuff. So I hope this is helpful for you.